Hello and welcome to Afternoon Tea with Docs. I'm Dr. Linda, emergency and lifestyle medicine physician, tuning in from Sheffield, UK. Do you let us know where you're tuning in from? I love to know which part of the world is listening to us and to share our common mission. It's very, very lovely to see so many familiar faces joining us who have been already waiting from 4 o'clock for Shireen's arrival. So it's very exciting to see you all. Welcome. And if you're new to our show, well, we are here every Sunday at 5 p.m. UK time, bringing you world-renowned health experts like our guest today, Dr. Shireen Kassam, with the mission to bust medical misinformation and share practical, evidence-based lifestyle advice that you can implement right away to help you prevent, treat, and reverse chronic diseases in a very supportive community setting. After the interview, if you have joined us here on Zoom, you will be able to speak to us and our guest expert off camera to ask your burning questions. You can join us on social media if you haven't said hello there on Instagram, Facebook, and LinkedIn by searching for the handle Afternoon Tea with Docs. And now, whilst all of our events and community support is accessible free of charge and will always be, if you would like to support us, you can buy us a cup of tea by searching on our website /donate. Now, we have a lot to speak about, but I would love to introduce our guest if you haven't met her before. She is Dr. Shireen Kassam, who is a consultant hematologist and honorary senior lecturer at King's College Hospital, with a very specialist interest in the treatment of patients with lymphoma. She is also passionate about promoting plant-based nutrition for the prevention and reversal of chronic diseases and for maintaining optimal health after treatment of cancer. Shireen discovered the power of nutrition for the prevention and treatment of diseases in 2013, and since then has been following a whole food plant-based diet herself. She has immersed herself in the science of nutrition and health and completed the E. Cornell certification in plant-based nutrition. In 2019, she became an international board-certified lifestyle medicine physician. Shireen founded Plant-Based Health Professionals UK in 2017 in order to bring evidence-based education on plant-based nutrition to the UK. Since then, she has been appointed as visiting professor of plant-based nutrition at Winchester University, where she has developed and facilitated the UK's only university-based CPD-accredited source and plant-based nutrition for healthcare professionals. In January 2021, Shireen co-founded and launched the UK's first CQC-registered online multidisciplinary plant-based lifestyle medicine healthcare service, Plant-Based Health Online. She's also a member of Research Advisor Committee for the Vegan Society. Her work has been published by Times, Mirror, Metro, Plant-Based News, and BBC Food. And I'm personally a great admirer of her work. I don't know where you're finding all the time to educate, publish books, and actually work at the same time in clinical setting. I would love to welcome you. Thank you so much for joining us today, Shireen.
Oh, thanks, Linda. It's so lovely to be back, and congrats on a highly successful first year of Afternoon Tea. It's been a pleasure to watch and also to support.
Thank you so much. I would love to start because we have a lot to discuss. I would love to start with your book today. You have written and published your first book, which I would like to share in a minute, but as I do so, please let us know what inspired you to publish this book.
Yeah, thanks for asking, and it still feels weird to hear this talked about. So I've co-authored it with my sister Zara, who some of you may have come across, is based in Canada, similar path to plant-based nutrition as myself, and is also a cancer doctor herself, but more solid tumours, so breast and GI, and runs Plant-Based Canada in Canada. So we've co-authored it, so it made it much easier than writing a book myself, but it really brings together some of the learning since 2013 that I've done myself, had the pleasure of learning from other experts learning through providing education at plant-based health professionals, and also, of course, the Winchester course, and realizing that, you know, the UK was in need of a book that really brings together some scientific answers to nutrition questions about plant-based diets, because we all know we all get asked the same questions over and over again. So it was sort of that experience, our lived experience of being embodied in this kind of plant-based nutrition world, as a vegan, as a doctor, and bringing that knowledge together. And we were in part inspired by a book, which I don't know whether viewers have read, but a book by Gary Francione called Eat Like You Care. So when my sister and I first became vegan, it was a book that was recommended to us, and it's a really nice Q&A format that goes through all those common questions you get asked when you first become vegan in the broader sense of the word as a social justice movement. And, you know, most people who aren't vegan want to ask you very similar questions that can be really challenging to answer. And we hadn't seen a similar book for the nutrition aspects of veganism, which clearly is a plant-based diet. So we use that Q&A format, which I think is which I hope is quite accessible for people to sort of, you know, read in a linear fashion or flick through and look for the questions that they've been interested in answering and not really finding the answers to.
It's a fascinating book, and it's exactly that. It's a very practical approach to understanding the science behind nutrition, which can be really complicated and not evidence-based, to say the least. So you can purchase this book, Eating Plant-Based, Scientific Answers to Your Nutrition Questions, on Waterstone, Amazon, and search on other websites as well. So fantastic, thank you. And we have a lot to discuss today. We will be speaking about the science of nutrition that you have covered the last whole year. So let's start with the research. We would love to start in the beginning with whole food plant-based diets and its effect on what we are facing every day right now, the pandemic, COVID-19. So nutrition and viral infections. What have we found on that topic?
Yeah, so, you know, highly topical, isn't it? And I've been, as you know, I've been writing a sort of weekly blog on science papers, looking at plant-based nutrition impact on health outcomes, and more recently adding in, you know, impacts to planetary health since sort of September 2019. And I've been keenly sort of reading and digesting all the information that's been coming out about diet and COVID-19 outcomes. And although at the start of the pandemic, sort of for us, it felt like March 2020 here in the UK, you know, everyone was sort of advising adopt a healthy diet, make sure you get all your nutrients and vitamins and minerals and support your immune system. So, you know, everyone was advising what we know to be true for other respiratory infections like influenza and bacterial pneumonia. We know that eating lots of colourful fruits and vegetables, whole grains, beans, you know, all of those healthy plant foods supports our immune system by providing the essential micronutrients. And so that was the kind of general advice, but we didn't really know if it was going to have any meaningful impact on outcomes from COVID-19. But, you know, over the last 18 months, it's been a really exciting story that's unfolded. You know, the first thing that we learned was that underlying chronic illness was increasing the severity of COVID-19 and making it more likely that somebody would require intensive care and sadly ultimately die. And I don't need to tell you that, Linda, and that you see that on a daily basis. So, you know, the majority of bad outcomes are really in individuals who have got what we sort of loosely term sort of lifestyle illnesses, such as cardiovascular disease, even things we accept as relatively normal, like high blood pressure and high cholesterol. And of course, you know, we've kind of normalized type type 2 diabetes, which 1 in 10 people over the age of 40 now suffer with in the UK. So that was the first thing we learned, and therefore it was kind of obvious that if we adopted healthy lifestyle habits, we could make a big impact on our risk of COVID-19. And then we started getting papers that had examined the health of the gut microbiome in people who developed COVID, and whether the microbiome was implicated in severity. And the answer was yes. The healthiest gut microbiome was associated with lower inflammatory markers and a better outcome. So sort of the implication was that, if you looked after your gut by feeding the microbes lots of fiber-rich foods, that you could improve your health outcomes, and including COVID-19. And then it was sort of later or earlier this year, I should say, that we've had a couple of papers really demonstrating that the closer you get to a plant-based diet, the better the outcomes from COVID-19. Now, of course, there's lots of confounding factors, and you can say it's association and not causation, but it's pretty good evidence, especially when we've got decades of knowledge telling us that a healthy way of eating is to center your diet around fruits, vegetables, whole grains, and beans. So the best study that's come out is from the Zoe COVID app symptom study, which I know that a lot of people here will already know about. And it reported outcomes in nearly 500,000 people who are participating in that app study from UK and US. And they looked and analysed their dietary data, and they used the plant-based diet index, which anyone who's been reading my blogs will know about. It sort of scores healthy plant foods positively, and then it scores all animal foods negatively, and all unhealthy plant foods such as refined grains and juices and cakes and pastries negatively. And of course, it found what we all predicted, was that those who centered their diet around healthy plant foods, so a healthy plant-based diet, had a 10% reduced risk of actually contracting COVID-19, but if they did, they had a 40% reduction in severity. And this was after adjusting for underlying chronic conditions. But what they found was also, what's very interesting, was that those who benefited the most were those from lower socioeconomic background. So we also know that sort of, your socioeconomic background really impacts your health outcomes for reasons that, are obvious to most people, but they're the individuals that really we can help the most by, targeting diet and lifestyle interventions.
That's really empowering to hear that it is for those who are in low socioeconomic areas. That's where I work as well. And unfortunately, that's where I see the worst health outcomes from COVID as well, when I'm comparing with our colleagues, discussing the topic across the whole of the nation. So that's really reassuring to hear. Can I ask you a little bit about the long-term changes in the gut microbiome metabolites, the TMAO, trimethylamine N oxide, and coronary heart disease? You have touched on it a little bit, but could we talk about that a little more?
Yeah, well, that's an interesting topic, and I think the science is evolving there. But, the gut microbiome, or the bacteria which we've learned the most about, are obviously not inert. They are, when they're fed lots of fiber-rich foods and exposed to polyphenols in the diet, they actually contribute to generation of these active metabolites. And the ones that we want lots of are things like short-chain fatty acids, so butyrate, acetate, which we know impact the immune system positively, plus connect with all the different body organs such as the lung and the brain, and even our bones. We had a webinar recently that talked about the joint gut axis, which I'd never heard about. But there are other metabolites that are produced that may or may not be associated with good health. They may be detrimental. And one of the metabolites that is formed by a diet which is high in choline and also carnitine is TMAO, as you say, trimethylamine oxide. Now, the science is a little mixed on this, and I'm keeping an eye open on the evolving data. But what was first reported back in 2013 was that, if you had a diet high in essentially eggs and meat, which is predominantly the foods that are contributing to choline and carnitine, then you had higher levels of TMAO, and that directly contributed to an increased risk of atherosclerosis through affecting the lining of the arteries, forming plaques, affecting the platelets, creating inflammation. But since then, we've had studies that suggest that actually that's not causal, it's just an association, and it might be the underlying chronic illness that leads to higher levels of TMAO. Now, I don't think that really matters, because what's clear is that when you follow people for a long time, like they've done in the Nurses' Health Study and the Health Professionals Follow-Up Study, what they found was that people with the highest levels of TMAO over that time period had a higher risk of cardiovascular disease. However, if people had changed their diet somewhere along that 30-year period and had reduced their levels of TMAO by eating more healthy plant foods and less meat and eggs, then they reduced their risk of atherosclerosis. So to me, it doesn't really matter. I think it just points in a direction of the type of diet you're eating, and certainly a diet heavy in animal foods tends to be associated with higher levels of TMAO. And that also association is seen in increased risk of heart failure, type 2 diabetes, renal failure, stroke. So every sort of chronic illness that we see on a daily basis is associated with a higher level. Whether it's causal, I'm not sure, but I would prefer to have a lower level myself, and the easiest way to do that, and you can change it very quickly. We're not talking about long term, we're talking about changing the gut microbiome. Within a couple of weeks, you can see changes in TMAO.
I would love to touch a little bit more on cardiovascular disease as a whole, and there was a Cochrane review on reducing saturated fat intake for CVD. Why I'm asking about this is because in my clinical practice, as we were talking just before we started, I seen a fourfold rise in heart disease presentation, so high blood pressure and heart attacks. So just to compare what it was like before the pandemic, I would see 1 or 2 MIs, STEMIs or non-STEMIs a day. And now after the lockdown, after people stopped eating healthily because they're at home, they're a bit bored, they have access to more food on a regular basis, and they are moving less, they are not going to work. I think all of that has somehow contributed to what we are seeing. It must have, because the change went from about 1 to 2 heart attacks a day to about 4 to 6 every single day. It's really scary, and I would love to highlight the importance of eating healthily. So what did this Cochrane review tell us?
Yeah, well, I'm really sorry to hear that. Such a sad situation, because I guess we've known for decades that probably 90% of heart disease certainly could be prevented by addressing lifestyle factors, not just diet, but as you say, all the pillars of lifestyle medicine. But we've had the InterHeart study that have shown us that if you address all of these, 90% could be prevented or at least significantly delayed. And cardiovascular disease as a whole still remains the top cause of death globally. So we're not really winning on that front. Yet we know that we could make such a major impact. I'm diverting a little bit, but Finland really showed us back in the 70s how their North Karelia project, where they addressed at a population level through government policy that providing education and the skills and knowledge that are required to change diet on a population level, what impact that could have. And they did that by increasing the consumption of fruits and vegetables, swapping out their saturated fat mainly from sort of animal foods and butter to sort of plant sources of fat, addressing smoking, physical activity, all those things, all the lifestyle pillars that you may think of, but doing it at a government level, that they slashed the rates of death from heart disease by more than 80%, which is truly remarkable. 2 decades later, they now have really great outcomes. So it's a testament to what can be done if we sort of had the will as a community. But I think what's clear, in the Cochrane review have shown on more than one occasion, but there was one from 2020 looked at the impact of eating saturated fat on coronary heart disease. And I think it still remains a topic of confusion, but there is no doubt that most saturated fats, not all of them, not the one from dark chocolate, but most saturated fats found in animal foods lead to a linear increase in LDL cholesterol. And we now know that LDL cholesterol is directly causal. It is the number one factor that leads to atherosclerosis and hence coronary artery disease and the myocardial infarctions that you're seeing on a clinical on a clinical level. So the take home of that is that we really should stick to the guidelines, which is to keep saturated fat intake to a minimum and definitely less than 10% of our calories. And the only sensible way to do that is to center your diet around healthy plant foods and to minimize or avoid animal foods, which are the main source of saturated fat in the diet. And that can really both impact the incidence of coronary heart disease and also, your longevity, the chances of actually dying from heart disease. So, that's an easy, quick win, isn't it? Swapping in the plants and minimizing the saturated fat. You don't need to think about saturated fat if you're just centering your diet around fruits and vegetables, whole grains and beans.
And we are always talking about prevention. And to prevent, we need to start even before birth. But let's talk a little bit about children. And there's always a question, should my kids eat more whole foods and plants? I mean, it's not a question for me, but I think there's a lot of misconception around this topic. So what does the research say? Should our children eat more whole foods and plants?
Yeah, simple answer is yes. And I think the media have done a great job of muddying the waters this year. I think if we're going to pick the one myth in the mainstream media that's been sort of fueled is about, how vegan children are going to be shorter and have poor bone health and not thrive and have, B12 and vitamin D deficiency and all the rest. But what I covered in this week's review was that we've really had a number of studies now from Germany, which have been the most robust review of vegan diets in children. They've published data on the health of vegan children, comparing them to vegetarian and omnivorous children, looking at age ranges of 1 to 3 and then older children into adolescence. And we've had papers on macronutrient consumption, micronutrient consumption, and also growth. And also like body weight and markers such as cholesterol, which we know, as we said, was so important to keep low at the earliest age possible. Because the one thing to say about LDL cholesterol is that it's definitely a cumulative effect. So the longer we can keep it low, the better it is for our health. So although, when we see our blood results at one point in time, we'll say, start some lifestyle changes. But actually, you've potentially had decades if you're just getting your 40-year person check or, 40-year woman's check and finding your high cholesterol. You might have already had those decades of damage to your coronary arteries. So, really important to know what's happening in children based on their diet pattern. And these the German data looks really, really robust and reassuring. Children grow absolutely fine, they develop fine, their body mass and body fat is favorable compared to omnivorous children. They're getting enough macros, especially protein. We all worry about they're getting more than enough protein, vegan children. And, they have more favorable biomarkers that we know will predict for better heart health, which is a major, major advantage. Now, everything comes with caution and caveat. We know that a vegan diet, along with any diet pattern, needs to be well planned. And there've been a few studies highlighting the nutrients that we need to pay attention to, probably in adults as well as children. So calcium, iodine, vitamin D3, vitamin B12, and iron, if I didn't say that, and iron can sometimes be lower. But none of these issues are insurmountable. We have a chronic deficiency of fiber and folate and vitamin C and E and magnesium in omnivorous children. So, every diet pattern has their issues that need to be dealt with, and a vegan diet is no different, but there do seem to be some advantages for children. And certainly, at a minimum, we can say there's no disadvantage at all from what I can see. I think some of the the flashy headlines come from studies that have had children that haven't optimized their diet, and that's fine. It's fine to report that, but I think we have to put it into context that if you don't plan your diet well, then there will be issues, but there are many ways to make a vegan diet healthy for children.
Unfortunately, they do highlight them very aggressively when it happens on a vegan diet, on a whole food plant-based diet. But very rarely do they actually talk about all of the heart disease that we are seeing every single day. People are dying from it in my department every day, and it is associated with the wrong diet. It's with the Western diet. And when we talk about children, we must talk about dairy. It's something really close to my heart as well, because my personal health really deteriorated due to the high consumption of dairy as a child. And growing up, unfortunately, I didn't know about the risks of dairy myself. And it was a very easy, high calorie food that I could always reach to, even in a hospital. One glass of milk, you kind of feel full, but every time I drank it, I didn't understand how it was contributing to my non-specific colitis. And once I personally cut it out, it just helped me to get off of my medications. And I would love to address the science behind dairy consumption and other risks for children particularly.
Yeah, well, it's really interesting to hear your story, Linda, and I'm sure you've met many that have had similar successes with healing their chronic illness by giving up foods like dairy and of course eggs and meat as well. And the thing is, I guess we just don't ask enough, do we, in our clinical practice about whether foods trigger certain symptoms, because as we know, if we bothered to ask our patients, they'd probably tell us what they thought was creating symptoms and problems for them, because as you say, ultimately we realize when we listen to our bodies. I think the dairy can be a difficult topic to tease out in the medical literature, because overall you might say that it's kind of neutral, like it really depends what the bulk of your diet is. So, for example, if you are consuming dairy instead of soda drinks, well, that's going to be probably better. But if you are, swapping dairy and cheese and yogurts for sort of, fruits and vegetables and beans and legumes and soya and stuff, then, you're going to see a benefit. And of course, 70% of the global population, and especially people of colour, are lactose intolerant. So that, dairy is just not even a relevant food to consume. But there's one thing that's clear, is that dairy is not required in the diet. That's absolutely, not required. It's one of the most common allergies in children. In fact, there was a paper in the BMJ this year that showed that dairy foods were the top cause of anaphylactic death in children now in the UK. And it's interesting, isn't it? Because we spend a lot of time making sure our environments are nut-free, but nobody bothers about dairy so much, and you're left with trying to figure out what has dairy in it when it comes to eating out or going to people's houses or what have you. Restaurants, of course, do highlight dairy, but you do have to make an effort because it's so normalized. So it's certainly not necessary. In children, we know that it contributes to allergies, anaphylaxis, eczema, asthma, and of course acne. And all of these, although they may not be immediately life-threatening illnesses, they really do impair an individual's quality of life. And when we know that we can make a better choice, like choosing soya beverages, or even now pea beverages, with good amounts of protein, and when they're fortified, they have good amounts of calcium, then, I think we need to start changing the narrative. And it was actually sad to see in the National Food Strategy Review that dairy wasn't addressed. There was a lot of description about how dairy farming is creating greenhouse gas emissions, using land and water and all that. But then when it came to the recommendations, they didn't actually recommend cutting down dairy consumption, because I guess we're so wedded to it being normal. There's a very pushy dairy industry. They've co-opted scientists and doctors. I remember when we wrote an open letter about offering plant-based milks in schools and reducing or ditching the dairy. It was Hilary Jones, our favourite TV doc. He wrote to the government on behalf of this charity that promote dairy and free dairy in schools, and said that what we had said was terrible, and quoted the science to show that the children that avoid dairy have health issues. And obviously they were studies where children in general were not consuming a healthy diet. So it's interesting to see how the dairy industry have co-opted sort of advocates for them by sort of selling misinformation, and then doctors and scientists keep that narrative going. But the science is clear, you don't need it. You can make a better choice. But I guess we have to be honest, if you have small amounts of dairy in an otherwise plant-based diet, then that's fine, but it's certainly not necessary.
But certainly if you are having IBS, which a lot of my patients did, and I had myself, and quite a lot of family and friends, consider that dairy could be the cause. I think a lot of my patients actually reported feeling so much better after they considered it, because first you don't even consider it due to the fact that we are pushing it and we are promoting it as such a healthy choice. So it's hard to even think, could this be the cause of my IBS and other problems? So just consider it and see if you do cut it out, how you feel afterwards. And of course, if we do talk about dairy and parents are listening and they're worried about the calcium, could we advise them on where else could they get their calcium requirements that is actually much better source than dairy?
Yeah, great question. And I think it's relevant for adults as well, because we do know that vegans do need to emphasize those calcium-rich foods. So we have a great fact sheet on our Plant-Based Health Professionals UK website on calcium. We've got a new kids area that just puts all that information that we actually already had, but into one spot for families that are raising vegan children. And at a very basic level, it's eating lots of greens and beans. Fortified beverages are fine, so fortified soya and pea milk, fortified or calcium set tofu are great choices. And yeah, have a look at our fact sheet, and it will give you lots of practical tips of how to get enough calcium.
Super, thank you. And there are a lot of other fact sheets as well to answer most of your questions, to be honest. I do refer my patients to it on a regular basis, so thank you so much for making them. The next question is the big one: Mediterranean versus a vegan diet. It's always something that comes up on a regular basis, and I would love to know what we have learned in 2020.
Yeah, well, 2021 actually.
Oh, yeah.
Yes.
Time flies. This pandemic, time flies.
Yeah, so for the last 4 years, the Mediterranean diet has been voted the best diet by nutrition experts in the US, and all of us vegans and plant-based eaters are a bit bored of hearing this, because the vegan diet is always touted as being difficult and restrictive and all these words that are sort of negative, that we know that as soon as you have a bit of knowledge and skills and motivation, that actually it's none of those things. But anyway, that's where we are. So it was great to see finally a study on Mediterranean diet as prescribed in the PREDIMED study. So, we all know about the PREDIMED study, was one of the big studies that showed that a Mediterranean style diet with olive oil or a portion of nuts every day was useful for primary prevention of cardiovascular disease. So used the same PREDIMED study, which included 50 mils of olive oil, extra virgin olive oil a day, and compared it to the classic Physicians Committee low-fat whole food plant-based diet. So as your listeners will know, the Physicians Committee for Responsible Medicine really have sort of pioneered their version of a vegan diet, because obviously there's different ways to eat a vegan or a healthy plant-based diet. And one way is to keep your fats at a minimum by not adding oil, by minimizing or avoiding nuts, but centering your diet around fruits, vegetables, whole grains, beans, and mainly drinking water for thirst, and tea and coffee if you enjoy it. So it was a head-to-head comparison, 62 adults who were overweight, and it was a crossover style study. So everyone had the chance to experience both diets, and they were counseled by people who were advocates of the particular diet so that there was no bias. And they had 16 weeks on one diet, and then they had 4 weeks washout period, and then they swapped over to the alternate diet and had 16 more weeks. And as usual, the Physicians Committee had measured what people ate, their macronutrients, whether they stuck to the diet, and then their sort of biomarkers of health, such as their body weight, insulin resistance, blood pressure, blood lipid levels, and glucose. And really, well, I guess I view the study with a bit of bias, but overall, the vegan diet did pretty well. On all the parameters, it did better than the Mediterranean style diet. People on the Mediterranean diet did not lose any weight at all, whereas the vegan diet group lost 6 kilograms, which is quite remarkable for just 16 weeks, to be honest. And there was no calorie restriction, there was no portion control. It was eat until you're full, but the vegan group naturally ate 500 calories less because of the lower calorie density of the food. The only biomarker that did less well on the vegan diet was blood pressure. So both groups lowered their blood pressure by a few points, but the Mediterranean diet did better. And we can hypothesize why, maybe the polyphenols and the vitamin E and so forth in the olive oil might be beneficial. I'm an advocate of eating nuts, and I think nuts have a really positive impact on cardiovascular health. I would have liked to see some flax seeds added in, for example. Most of us on a plant-based diet would be eating flax on our oats, or sprinkling it on our salads or whatever, and we know that brings down your blood pressure. So there's many versions or reasons why maybe the Mediterranean diet did better, but overall, I think there was definitely no harm in the low-fat vegan group, and there was certainly many benefits. And it's a very valid option for addressing cardiometabolic health, which is another big study that came out this year, the systematic review of what is the best diet to treat all these cardiometabolic diseases. And they just reviewed all the plant-based data, and it came out really favorably compared to low-calorie diet, compared to the traditional heart disease diet that's recommended, the lowering cholesterol diet. Plant-based diets, whether it's vegetarian, vegan, or whole food plant-based, really showed a benefit compared to any other comparator. So I think we've got enough data to suggest that adopting a healthy plant-based diet, even in that situation where you're finding your patients with the heart disease, heart attacks established, is a really good diet to adopt, and will reduce your cholesterol, your body weight, your insulin resistance, your blood glucose. I mean, that's pretty remarkable.
It is indeed. And some of our guests actually had a question that has been repeated, so I might ask here about high blood pressure, and what are the exact foods that you think they could add to assist their blood pressure, although they are already on a whole food plant-based diet and they are more towards a vegan side. What are these lists of foods that do you think they could add to support a little bit more to reduce their blood pressure?
Yeah, really good question. Because, not everyone gets to the ideal sort of biometric numbers just by, adopting a plant-based diet. So there are tweaks that can be made. And I think, the top ones are making sure you're eating enough leafy green vegetables, so the nitrate-rich vegetables, which are mainly leafy greens, but also beetroot. So there's been a randomized study by the British Heart Foundation here in the UK, probably about 6 years ago, that looked at 2 glasses of beetroot juice, John White's they used, and it was 250 mils twice a day, and it had the same impact as medication. So definitely beetroot juice is great, but all the leafy greens, we know from our webinar with Dr. Esselstyn in that he insists that people eat a small portion of leafy greens 6 times a day with their balsamic vinegar or any form of acid to really activate your nitrate synthetase and, to get increased amounts of nitric oxide. So you can look up online, there's lists, and I think I've got an article on cardiovascular disease and that includes the blood pressure tip. So leafy greens and beetroot for sure. Flax seeds, there's been a randomized study on flax seeds, adding flax seeds to diet and blood pressure, so that's a really good one. Whole grains, just simple, so make sure that your grains are definitely whole grains. And I love the way that Brenda Davis talks about whole grains as a hierarchy. You think you're doing well, but you can always do a little bit better. So there's a hierarchy of whole grains and you can sort of up the ante there. Hibiscus tea is another one. So what else? I'm sure your audience have probably got some other top foods, but those are the ones that are in my mind at the moment.
Thank you for that. A little bit about meat intake and cancer risk. There is a prospective analysis that you have reviewed, and it's something that I once again see the rise in emergency department. Unfortunately, I'm diagnosing patients with metastatic cancer for the first time in emergency medicine in a younger and younger patients. Within the last 10 years, I have seen a huge increase in these presentations just from a personal perspective, but also we can see this in our research as well. So what can we say to those who are worried about cancer and would like to prevent it as much as possible?
Yeah, no, I mean, I think it's something that really we should all be concerned about, given that certainly in the UK, 1 in 2 of us are going to develop cancer, certainly those of us who are born after 1960. So, it's become such a prevalent problem, and you know as well as I that most cancer agencies state that 4 out of 10 could be prevented. So having an anti-cancer diet should be our top priority, along with an anti-heart disease diet, really. But safe to say, obviously, that we should mention not every cancer is preventable, but what also helps is that if you are going to develop cancer and you present with cancer, that actually you do not have other chronic illnesses, because treatment, from my viewpoint as somebody who treats cancer, is so much easier if you're not having to deal with diabetes and hypertension and heart disease and alter and modify your treatment approaches because somebody is not going to tolerate the optimum treatment. So, I guess there's 2 things there. And just while it's in my head, I guess we forget also that underlying chronic illness probably contributes to about 1/3 of the risk. So we don't talk about that enough, but in the first 8 years after a diagnosis of type 2 diabetes, there's a much higher risk of cancer. We know that heart disease, renal disease, lots of chronic illnesses, even inflammatory bowel disease, arthritis, increased risk of cancer, and that's because of all the sort of shared mechanisms of underlying chronic disease that ultimately sort of lead to inflammation as that common mechanism, whichever route it's occurred by. So avoiding all those preventable chronic illnesses will help you reduce your risk of cancer. But then when it comes to sort of lifestyle interventions, the 2 most preventable cancers are really sort of colorectal cancer, where over 50% of cases could be prevented through lifestyle interventions, and that's the one that sort of seems to be rising at the greatest rate in people under the age of 50, actually. So although sort of for older ages that the incidence isn't rising so quickly, and people put that down to the widespread adoption of screening, but under 50, that hasn't really been captured by screening programs, and really there's that's the age group where the incidence is rising, and there's been some prominent sort of celebrities who've succumbed in the last year to bowel cancer, but also breast cancer is highly preventable. And I think as we've said over and over, it's not one diet for one disease and another for another. We know it's all the healthy fruits, vegetables, whole grains, beans, nuts and seeds that are the only foods that have been associated with cancer prevention, and the cancer prevention diet that's recommended as a plant-based diet, and we've got data from vegan and vegetarian cohorts showing that reduced risk of cancer for vegans and vegetarians, with a greater impact for those following a vegan diet, and also we've got some at least one study using the plant-based diet index from a cohort in France, showing around a 15% reduction on just the plant-based diet. But then, of course, if you're adding in the avoiding alcohol, avoiding smoking, the regular physical activity, keeping a healthy body weight, then you can add to that relative reduction in the risk of developing cancer.
Another topic that I see a lot in clinical practice that has risen the last years is presentations with out of control type 2 diabetes. Patients are coming in with their sugars through the roof, 18, 19, 20, 22. And unfortunately, they are not really aware of the risks associated with it, even though they have been living with it for a really long time. That's one of the problems. But the second is also the problem how they are perceiving carbohydrates. Like all carbohydrates are the same, and they're really, really scared to eat fruits and vegetables and legumes. What should we say to them with regards to their diet?
Well, I think our book, Eating Plant-Based, covers this in virtually every chapter because it's so pervasive in our society and the narrative that's out there that carbohydrates are feared. I mean, it's a bit like, fats in the 70s and 80s. So, as we all say, carbohydrates aren't a food group, are they? They are a nutrient that's present in a variety of foods, and carbohydrates can be your white bread and your refined sugar and your donuts and your cakes, or your carbohydrates can come in the form of fruits and vegetables and whole grains and beans. And obviously avoiding carbohydrates in its entirety, well, is not compatible with good health, but it's also avoiding every single food that has been associated with a reduced risk of type 2 diabetes, and that includes fruit. There's never been a study that's shown that eating fruit is detrimental to humans, let alone increasing the risk of type 2 diabetes. And in fact, there's been a study that has looked at consumption of fruit in people with type 2 diabetes. And again, there's an advantage there. So even when you do the studies, you can clearly show that fruit consumption along with vegetables and beans and so forth are really beneficial, and they're the exact foods that are going to help your patients to stabilize their sugars and ultimately reverse their diabetes. Now, the reason that somebody with type 2 diabetes might get a sudden spike in their blood sugar when they consume a banana or grapes or something that's thought to be high in fructose is because of the underlying insulin resistance. So that's just the symptom, but to reverse the actual cause, which is the fat in the muscle cells, in the liver cells, in the pancreatic cells, to get rid of that fat that's clogging up the insulin receptors, you need to eat those foods that are going to allow you to do that, and avoid foods that are high in saturated fat, which is the animal foods, and also avoid fructose, which is a sugar that's we consume predominantly through processed foods and soda drinks and things like that. So fructose, but you have to be consuming in more than the calories you need for fructose to be the problem. I mean, the major problem is all the meat, eggs and dairy, but equally you need to sort of minimize added sugars, processed foods as well, and stick to a whole food plant-based diet as much as possible. And the trouble is that when you've had your heart attack, when you've had your diagnosis of cancer or type 2 diabetes, you need to be pretty strict with yourself because you've got decades of reversal to get through. So although it's a process to sort of change to a whole food plant-based diet, the more changes you make, the more benefits you will get.
And I must address one of the questions that we just had here from Lindsay. I think it's quite relevant. If people are suffering from familial hypercholesterolemia, do these changes actually help?
Yeah, they do absolutely help with any form of high cholesterol, high triglycerides. But there's a caveat there that many people with familial hypercholesterolemia, and that's really when you have sky high levels of cholesterol, sort of above the level of sort of 9 and 10, you do need to have medications as well. But, we're not talking about instead of, we're talking about plant-based diet as well as whatever sort sort of allopathic treatments that you need, and that's often the case with familial hypercholesterolemia. I mean, I'm sure, Lindsay, maybe you know for sure that you or your friends or family members have that condition, but a lot of people also say to us in our clinical practice, oh, it's genetic, isn't it? And think that they've got, genetically high cholesterol. Well, actually, most individuals don't, and 90% or more of cases of high cholesterol are purely down to diet.
Could we address this question about genetics for a minute? Because too often we are attributing our current chronic diseases to genetics. Could we just dispel that a little bit?
Yeah, I mean, I think overall, in summary, only 5 to 10% of our risk of chronic illness comes from the genes that we carry. And every study that's looked at the combination of genetic factors and the overlying lifestyle factors have shown that regardless of your genetic risk, even if you are in a sort of high risk category for chronic illness, that you can greatly improve your risk of underlying chronic illness by adopting healthy lifestyle behaviours. One study that comes to mind from the UK Biobank study just published, I think it was this year or at the end of last year, was looking at colorectal cancer and looking at about 95 different SNPs, so single nucleotide polymorphisms that you find that can predict for a higher risk of colorectal cancer, and then looking at the lifestyle behaviours that are recommended by the World Cancer Research Fund. And they showed that those in the highest genetic risk were actually benefited the most from adopting those healthy lifestyle behaviours. So there's two factors there that, lifestyle really does trump genetics, partly because you can actually change the expression of the genes by adopting healthy lifestyle behaviours. But those that are going to benefit the most are those that might have a higher than baseline level of these illnesses because of their genetic predisposition. So, I think overall, it's the relevant message to everyone, regardless of baseline genetics, which at the end of the day play less than 10% of a role in the risk of chronic illness.
And it's so empowering to say that epigenetics, we have a hand in it. And as Dr. Ornish has shown in one of his studies, he showed that you can upregulate or downregulate your genetics depending on what you do. So if you eat well, you exercise, sleep well, and so on, you can upregulate the genetics that will fuel your health, and you can downregulate those that fuel your cancer and diseases. I think that is very empowering, and people need to remember this for the next year, that they do have a hand in their future. And of course, there's two bodies that we need: the body of ourselves and that of our planet, for us to actually exist. So let's talk a little bit about planetary health, our home, where we reside, without which we cannot exist. How does a whole food plant-based diet support our planetary health?
Yeah, I mean, I think, the last couple of years have just shown how vital that issue is. Our food system is at the center of so many of our global crises, the climate, the ecological, our soil crisis, my dad always reminds me of, and, of course, our health crises. And there is one solution to all of these issues. We were all quite disappointed by the discussions at COP26, which really didn't address food. But animal agriculture is a major driver of climate change, of ocean destruction, of deforestation, water pollution, and you can go on and on, can't you? And clearly the biodiversity crisis as well. We are in the 6th mass extinction event, and unless we pause and try and reclaim this biodiversity, we're not going to be here in 50 or 100 years in a healthy state. So there is so much that we can do with our food system, and some of those changes to a more plant-based food system we require government and policy change, but the single most impactful action we can take as individuals to reduce our carbon footprint is, of course, to adopt a healthy plant-based diet, because it's the animal foods that are contributing the most to greenhouse gas emissions, land use, water use, etc. And of course, we mustn't forget, generation of pandemic risk and also antibiotic resistance that I'm sure you're coming across in your daily practice as well. There was a study back in 2017, I think it was, that showed that if we all limited our meat consumption to just 40 grams a day, which is, you know, a small beef burger size, if that, that we could reduce our use of antibiotics globally by about 60%. So, you know, just reducing drastically could make a big impact. And just removing red meat from the diet, so beef, which is the main red meat that we eat here in the UK, we could reduce greenhouse gas emissions from the food system by more than 50%. So one of our final chapters in the book really covers these sort of interrelated but wider issues of the food choices that we make. And one of the studies I covered in today's review really looked at what could happen to both health of humans on a population level and the health of the planet if we all adopted a planet-friendly diet. And the sort of most well-known planet-friendly diet is the Eat Lancet Planetary Health Plate, which sort of is predominantly plant-based but allows about 13% of calories from animal foods if you want to. So it's not necessary, although they do make an emphasis that fish is good addition to the diet, and we can probably have a discussion about that separately. But what they were able to show was that, you know, you could vastly reduce diet-related illness, plus reduce greenhouse gas emissions and land use by over 50% if we all adopted that planet-friendly diet. And that isn't even a fully whole food plant-based diet. So whatever shift we can make, we can have a major impact on planetary health. And papers have shown that without diet change, we aren't going to meet our climate targets. So, you know, along with fossil fuels and various other actions that need to be taken, diet can't be forgotten about.
If you could touch a little bit on the fish diets, and if people decide not to eat fish, then what should they be supplementing with? Because it's a question that I see every day in my clinical practice. What do you think?
Yeah, it's a complicated issue with fish. I think most of the studies show benefit because people eating fish are not eating the red meat and the poultry and the eggs, etc. So if you swap in fish for those other animal sources of protein, then, you know, health will look like it's improved. But actually studies that have looked specifically at, you know, whether you swap the fish for beans, you can make even more added gains. So I mean, I think you can make a better choice for your health than fish, and a bit like dairy, it's really not necessary in a well-planned plant-based diet. I guess the nutrient that we all are concerned about is omega-3 fatty acids, the long chains, the DHA, EPA, which we make from the short chain fatty acids, but conversion of that can be different, and we don't measure it because we haven't got a reliable assay by which to guide us. So, you know, it's about emphasizing sources of ALA, so the short chain fatty acids in our diet, with the flax seeds, chia, walnuts, hemp seeds, and which also are good for so many health conditions. And then, you know, I think you make an individualized decision about whether you want to obtain the long chain preformed DHA, EPA from marine sources and marine algae, for example, rather than fish, of course, who acquire it from algae and plankton and what have you. So, you know, there's plenty of vegan supplements around. I don't think we've got the final answer on that question about do we all need to supplement. I don't think there's any harm in supplementing, not at the sort of nutritional levels. There can be harms at higher doses. So at the sort of cardiology type doses of over 1 gram, there's been an increased risk of atrial fibrillation, which has become apparent this year. But the sort of 250, 500 milligrams sort of range that we recommend for supplementation doesn't seem to result in harm, and certainly is necessary for pregnancy and lactation, and maybe for children who don't have a very diverse diet but are being raised as vegan.
But there's one concern with fish that we are starting to see, even in famous people like Victoria Beckham, who was not long ago actually hospitalized due to mercury poisoning. And so whilst there's a question with regards to omega-3, there is certainly no question with regards to the high doses of fish consumption can actually lead to harm if we are not paying attention.
Well, that's very interesting. I hadn't heard about Victoria Beckham, but yeah, I mean, ingesting mercury is clearly a problem, and certainly pregnant women are told to limit fish consumption and stick with smaller fish rather than larger fish, where all of these pollutants and contaminants are concentrated. And as you say, it's not just mercury, is it? It's the it's the PCBs and the dioxins, all these persistent organic pollutants, and it's also I've forgotten what the other thing I was thinking of. Oh, the microplastics, of course, as well. So yeah, and then we forget that actually the fishing industry is one of the biggest polluters of our oceans, and then it's contaminating our fish. So yeah, I mean, I think it's no longer sustainable to keep fishing, and certainly the whole world cannot consume 2 portions of fish a day. We just don't have enough fish in the oceans, and those that are left, unfortunately, are suffering the consequences of the polluted oceans that we then consume. And people forget it's actually similar for consuming other animal foods. Our biggest source of exposure to environmental contaminants come from animal source foods, dairy and fatty meats, because it's the fat that concentrates all of these persistent organic pollutants.
And Victoria Beckham wasn't the only one. Robbie Williams was also hospitalized in 2021 because of high fish consumption. Well, this is just fun information if anybody is following. So it's amazing. We have covered so much this hour, and I would love to ask if those people who would love to start on addressing a more plant-based diet in next year, how should they start?
Yeah, a great question. And we did write a little article in the British Journal of GP just about how, what are the sort of, 10 steps to take. And I think some of the easiest things that you can do, I think anyway, making your breakfast a really, feature of your meal times and making it a really healthy one. And I think we'll all agree that having oats and fruits and maybe flax seeds and some combination or other is a really great way to set up the day. We also had a great webinar on, timings of foods earlier this year from Hannah Kaliova from the Physicians Committee. And it's quite clear that having a big breakfast, but making it really healthy with those nutrients and foods is a really good way to set up the day. I think all vegans will say always be prepared, so don't be caught out, plan ahead, and make sure that if you're going out that you've called ahead and know what food's going to be available. Don't get caught short, and make sure you always have some snacks with you that are plant-based or healthy, so fruits and cut up vegetables and nuts and seeds, or those sort of nut bars if you're not allergic to nuts, but there's also protein bars and things around that are healthy that not necessarily based on nuts. So kind of always be prepared and have something available, or know where you're going to get something if you haven't taken your food with you. And I think just upping your green vegetables, I think it can be I find it quite difficult actually, to make sure I'm eating enough of the green leafies and the cruciferous, which is so full of all the nutrients. And I know you only asked for 3, but this year in the 2021, I did make mushroom my least favorite vegetable. The vegetable or the food of the year was definitely mushroom, because just in isolation, small portions of mushrooms every day seems to have like this magnificent effect on health.
And if our guests and listeners don't know, Shireen does not like mushrooms. So you see, you can overcome your dislike to some foods for your health. And we know that in 3 weeks, actually, our taste buds do change when we know that we are eating for better health. Now, I would love to also just promote your 21-day free challenge as well. You can start there on the website, right?
Yeah, no, absolutely. Thank you. So Leila Dekhan, our education lead, back in 2020 launched our 21-day plant-based health challenge. So you sign up for free 21 days of emails and recipes. I think you end up downloading a book with 50 different recipes from around the globe from very diverse contributors, some videos. And then this year we've been able to add a live Zoom Q&A session with Leila as well. So you'd get those notifications and join live or listen back to the Q&A. So it's a great resource, and for anyone who's thinking of trying veganuary or got family members, it's a great thing to just sign up for and have that information to store and look back at for your future use as well.
It's incredible. You get a free resource menu and also somebody supporting you through your plant-based journey. And I also would like to highlight the 6-week Winchester University course that you have co-written and led with your incredible team. And also quite a few of our listeners here have done this course who are not healthcare professionals to learn more about their own health, to empower themselves about the science of nutrition. And I have done this course as well, highly recommend it to everyone. When can they sign up to this course?
Yeah, so that we've got places starting 6th of February. So we're currently in a December, January running, but the next dates and there's availability for 6th of February. It's actually now 8 weeks because the one thing everyone complained about was not enough time. So there's 6 modules, self-paced. You can do it over 8 weeks and in your own time. Somebody this time did it in 1.5 weeks, which has got to be the fastest ever. So depends what time you want to put aside, and most of the resources are downloadable and you can store and look back at later, and there's as you say, it's a team effort from my friends and colleagues from Plant-Based Health Professionals UK who have supported with the video content, and you get written content, and there's myself and Leila there to answer all your questions along the way. So we're there every day basically, interacting with students online. And actually this year we launched, for past participants, you hopefully will have notified, we're actually starting sort of biannual updates, so half-day study days, CPD accredited, so people can keep up with knowledge, because as you've seen from this year's resource, we've got buckets of science to discuss, and it's very difficult to cover everything in just 8 weeks.
It is just, you really blow my mind. The amount of work you do is incredible, and this course is incredible, guys. So do check it out, and it's so affordable. You won't get this amount of knowledge anywhere else about a plant-based and diet and the science of nutrition to support your health, your family's health, and your community's health. And also, I do have an ulterior motive here, because the more you learn about it, the more you read Shireen's work, the less work I have in the emergency department. Okay, so we can massively reduce our waiting times by you getting healthier, and guess what? Win-win. I can have more cups of tea and you can be at home instead of in the waiting room. So if you would love to connect with Shireen, please connect with her on Instagram, and you can follow her on Facebook. You can check out her website. All of the links are here in the chat. We have shared it once, and I'm going to share it again just now, also about the course. And if you're watching us on YouTube, you can check it out in the comments, plantbasedhealthprofessionals.com. And you can find her with that tag everywhere else. So thank you so much for joining us today, Shireen. It has been incredible as always, and for being the honor or guest of our first year of Afternoon Tea. It's been fantastic. Thank you.
Oh no, well thank you, Linda. You guys are doing an incredible job, and lots of love to Erica. We miss her, and yeah, look forward to what the next year has in store for you and all of us.
Absolutely. And so for everybody who has joined us on Zoom, Shireen will be so kind to stay with us for a few more minutes to answer any of your personal burning questions that you can share here on the community. Once again, if you would like to connect with Afternoon Tea with Docs, you can check it out on Instagram, Facebook, and on LinkedIn. Say hello. Let us know how you're feeling, what questions you have about your lifestyle. If you would like to support us, then you can donate as well on afternoonteawithdocs.com/donate. Thank you, and see you later.